All right. So it's the same thing as yesterday. If you guys haven't signed up on NAC, please make sure you do that. And let's get started. So today's just mostly going to be practice questions, and then at the end, if you have any questions, I'll answer those. So the first question is, when providing respectful, appropriate nursing care, how should the identity of the patient and their how should we identify the patient and their observable characteristics? A, the manic patient in room 234. B, the patient in room 234 is manic. C, the patient in room 234 is possibly a manic. D, the patient in room 234 is displaying manic behavior. And you can unmute yourself or put it in the chat. All right, so the answer to this one is D. You want to make sure you refer to patients by more than just their diagnosis. You want to make sure you refer to them still as a person. So they have this diagnosis, but it's a person with it, they're not defined by their diagnosis. So the next question is, which statement made by a patient demonstrates a healthy degree of resilience? Select all that apply. A, I try to remember not to take other people's bad moods personally. B, I know that when I get really mad, I'll end up being depressed. C, I really feel that sometimes bad things are meant to happen. D, I've learned to calm down before trying to defend my opinions. E, I know that discussing issues with my boss would help me get my point across. All right, so the answers for this one are A, D, and E. So resilience is just the ability to come back from a challenge or a rough patch. Okay. Which statement demonstrates the nurse's understanding of the effect of environmental factors on a patient's mental health? A, I'll need to assess how the patient's family views mental illness. B, there is a history of depression in the patient's extended family. C, I'm not familiar with the patient's cultural view on suicide. Or D, the patient's ability to pay for mental health services needs to be assessed. All right, the answer to this one is C. So a large part of the environmental factors is one's culture, the culture that they're surrounded by. A nursing student new to psychiatric mental health nursing asks a peer what resources he can use to figure out which symptoms are present in a specific psychiatric disorder. The best answer would be A, National Institute of Mental Illness, B, National Alliance on Mental Health, C, International Classification for Nursing Practice, D, DSM. Okay, the answer to this one is D. DSM helps diagnose psychiatric disorders. It does not treat them. When discussing therapy options, the nurse should provide information about interpersonal therapy to which patient. Select all that apply. A, the teenager who is the focus of bullying at school. B, the older woman who has just lost her life partner to cancer. C, the young adult who has begun demonstrating hoarding tendencies. D, the middle-aged adult who recently discovered her partner has been unfaithful. All right. The answers to this one are A, B, and E. So interpersonal therapy is best for treating grief and loss, interpersonal disputes, and role transition. All right. The next question, a nurse is assessing a patient who graduated at the top of his class, but now obsesses about being incompetent in his new job. The nurse recognizes that this patient may benefit from the following type of psychotherapy. A, interpersonal, B, operant conditioning, C, behavioral, or D, cognitive behavioral. Okay, the answer to this one is D. Cognitive behavioral therapy helps patients identify negative unconscious thoughts and turn them into more positive thinking. According to Maslow's hierarchy of needs, the basic needs category for nurses to address is A, physiological, B, safety, C, love and belonging, or D, self-actualization. Okay, the answer to this one is A. Physiological needs is at the bottom of the pyramid, then safety, belonging and love, self-esteem, and then self-actualization. In an outpatient psychiatric clinic, a nurse notices that a newly admitted young male patient smiles when he sees her. One day, the young man tells the nurse, "You are pretty like my mother." The nurse recognizes that the male is exhibiting A, transference, B, expression, C, countertransference, or D, cognitive distortion. All right. The answer to this one is A, transference. So transference is patient to nurse, whereas countertransference is nurse to patient. Linda is terrified of spiders and cannot explain why. Because she lives in a wooded area, she would like to overcome this overwhelming fear. Her nurse practitioner suggests which therapy? A, behavioral, B, biofeedback, C, aversion, or D, exposure and response prevention therapy. All right, the answer to this one is exposure and response prevention therapy. So this is a gradual exposure to a stimulus, and you want to prevent the anxiety response. A patient has been voluntarily admitted to a mental health facility after an unsuccessful attempt to harm himself. Which statement demonstrates a need to better educate the patient on his patient's rights? A, I understand why I was restrained when I was out of control. B, you can't tell my boss about my suicide attempt without my permission. C, I have a right to know what all you are planning to do to me. D, I can hurt myself if I want to. It's none of your business. All right, the answer to this one is D. Patients have the right to safety, but they do not have the right to harm themselves or others. The mental health team is determining treatment options for a male patient who is experiencing psychotic symptoms. Which questions should the team answer to determine whether a community outpatient or inpatient setting is most appropriate? Select all that apply. A, is the patient experiencing suicidal thoughts? B, does the patient have intact judgment and insight into his situation? C, does the patient have experiences with either community or inpatient mental health facilities? D, does the patient require a therapeutic environment to support the management of psychotic symptoms? E, does the patient require the regular involvement of their family or significant others in planning and executing the plan of care? All right, the answer to this one is A, B, D, and E. It is important to determine the patient's mental state, their ability to interact and be involved in their plan of care, their ability to make decisions about their care, and how much they understand about their condition. An Afghanistan conflict veteran has been homeless since being discharged from military service. He is now diagnosed with schizophrenia. The nurse practitioner recognizes that ACT is a good option for this patient since ACT provides A, psychiatric home care, B, care for hard to engage seriously ill patients, C, outpatient community mental health center care, D, a comprehensive emergency service model. All right, the answer to this is B. ACT is used with patients that have severe mental illness that makes it hard for them to seek treatment themselves. These patients may have repeated hospitalizations or ER visits. ACT brings the treatment to the patient. An adolescent female is readmitted for inpatient care after a suicide attempt. What is the most important nursing intervention to accomplish upon admission? A, allowing the patient to return to her previous room so that she will feel safe. B, orienting the patient to the unit and introducing her to patients and staff. C, building trust through therapeutic communication. Or D, checking the patient's belongings for dangerous items. All right, the answer to this one is D, safety is always number one. Emma is a 40-year-old married female who has found it increasingly difficult to leave her home due to agoraphobia. Emma's family is appropriately concerned and suggests that she seek psychiatric care. After investigating her options, Emma decides to try A, telepsychiatry, B, ACT, C, psychiatric home care, D, outpatient psychiatric care. All right, the answer to this one is A, telepsychiatry. So agoraphobia is the fear of leaving their home or their safe environment. So telepsychiatry would be most appropriate because they're most likely to attend their meetings. While you are working with a family whose son was admitted due to a psychotic break, you observe the mother say to her son, "What, no hug for your mom?" As the son embraces his mother, she stiffens, which results in the young man backing away. She responds, "You only care about yourself." What behavior is the mother engaging in? A, triangulation, B, scapegoating, C, double binding, or D, differentiation. All right. So the answer for this one is C. Double binding messages are messages that contradict themselves, so their verbal and nonverbal messages do not align. Which of the following family members should you refer to individual therapy rather than family therapy? A, a mother who has anxiety controlled by medication. B, a father who is questioning his sexuality. C, a son who is verbally abusive toward his parents. D, a daughter who has been treated for alcohol use disorder. So the answer for this one is B. Family therapy would not be beneficial in this circumstance as it would cause confrontation and would not help him organize his thoughts or feelings. Emotional support is an important family dynamic because it allows family members to A, feel secure enough to explore aspects of their personality, B, feel isolated and fearful even though family members are near, C, grow without boundaries within the family unit, D, have bursts of anger without recourse or shame. So the answer for this one is A, support increases physical and mental well-being. Which intervention demonstrates the nurse's understanding of what guides effective nursing care with a diverse patient population? A, treating all patients the same to avoid prejudicial actions. B, identifying the cultural norms of the population being served. C, recognizing that race and ethnicity result in specific illness management views. D, addressing the physical and emotional needs that originate from genetic factors. The answer for this one is B. Make sure to perform culturally sensitive assessments, do not make assumptions about the patient's culture, and make sure you ask questions. Which assessment questions will support effective communication with a patient who recently immigrated from an Asian country? Select all that apply. A, what do you call this kind of pain? B, what do you think is causing your pain? C, how do you think your pain should be treated? D, do you consider this kind of pain a serious problem? E, do you think American medicine will help your pain? All right, so the answers to this one are A, B, C, and D. So you want to make sure you do culturally sensitive assessments, ask what different aspects of mental health and their culture mean to them. What statement by the nurse demonstrates ethnocentrism toward the Latin patient? Atlantic. A, what do you want us to do to help your symptoms? B, tell me more about what you think is causing these symptoms. C, I'm sure we can do something to make your symptoms more manageable. D, how much have these symptoms made it more difficult for you to go to work? All right, the answer to this one is C. This option shows control of the nurse. It doesn't give the patient the choice regarding their care. Yeah. Okay. Ling has a nursing diagnosis of risk for violence. Ling's Eastern culture family is having difficulty coping with the illness because of their beliefs. A favorable therapeutic modality for this patient might include A, outpatient therapy, B, family therapy, C, long-term inpatient care, D, a simulation therapy. All right, the answer to this one is B. Family therapy is a controlled environment that facilitates communication among the family members and allows for development and exploration of cohesiveness, communication, appreciation, commitment, coping strategies, and collective beliefs and values within the family unit. Intergenerational conflict may arise in immigrant families because the process of acculturation may be A, ignored due to cultural beliefs, B, filled with traumatic experiences, C, easier for children, D, a function of assimilation. The answer for this one is C. Acculturation is assimilation to a different culture. So it's easier for children because they haven't been surrounded by a certain culture their entire lives. They'll grow up in this specific culture. Which nursing actions demonstrate cultural competence? Select all that apply. A, planning mealtime around the patient's prayer schedule. B, helping a patient to visit with the hospital chaplain. C, researching foods that a lacto-ovo-vegetarian patient will eat. D, providing time for a patient's spiritual healer to visit. E, ordering standard meal trays to be delivered 3 times a day. All right, the answer to this one is A, B, C, and D. Follow the patient's dietary needs, prayer schedule, allowing their religious leaders to come visit, or scheduling appointments, work around their cultural or religious needs. Which intervention demonstrates the ethical principle of beneficence? A, refusing to administer a placebo to a patient. B, attending an in-service on the operation of a new IV infusion pumps. C, providing frequent updates to the family of a patient currently in surgery. D, respecting the right of the patient to make decisions about whether or not to have ECT. All right, the answer to this one is C. Beneficence is doing good, doing what is in the patient's best interest. When considering faculty admissions for mental health care, what characteristic is unique to a voluntary admission? A, the patient poses no substantial threat to themselves or to others. B, the patient has the right to seek legal counsel. C, a request in writing is required before admission. D, a mental illness has been previously diagnosed. All right, the answer to this one is C. Voluntary admission is when the care is sought directly by the patient or guardian. And then involuntary admissions is when the patient is admitted without their consent. Which situations demonstrate liable behavior on part of the staff? Select all that apply. A, forgetting to obtain consent for electroconvulsive therapy for a cognitively impaired patient. B, leaving a patient with suicidal thoughts alone in the bathroom to shower. C, promising to restrain a patient who stole from another patient in the unit. D, reassuring a patient with paranoia that his antipsychotic medication was not tampered with. E, placing a patient who has repeatedly threatened to assault staff in seclusion. All right, the answer is A, B, and C. Informed consent is needed for all procedures. Suicidal patients are not to be left alone. They require one-on-one observation from an arm's length. Always start with the least restrictive option first. Lucas has completed his inpatient psychiatric treatment, which was ordered by the court system. Which statement reveals that Lucas does not understand the concept of conditional release? A, I will continue treatment in an outpatient treatment center. B, my nurse practitioner has recommended group therapy. C, I am finally free, no more therapy. D, attending therapy and taking my medications are a part of this conditional release. All right, the answer to this one is C. Conditional release requires outpatient treatment and follow-up evaluation. Unconditional release is the end of the treatment. Implied consent occurs when no verbal or written agreement takes place prior to a caregiver delivering treatment. Which of the following examples represents implied consent? A, the mother of an unconscious patient saying okay to surgery. B, care given to a heroin overdose victim. C, immobilizing a patient who has refused to take medication. D, signing general intake paperwork with specific parameters. Okay. The answer to this one is B. Implied consent, so when care is provided to a patient without a formal discussion beforehand, those who are unconscious cannot consent, however, they still need to receive basic care. Based on Maslow's hierarchy of needs, physiological needs for a restrained patient include, select all that apply. A, private toileting and oral hydration. B, checking the tightness of the restraints. C, therapeutic communication. D, maintaining a patent airway. All right, the answer to this one is A, B, and D. So physiological needs are going to be the patent airway, toileting, hydration, and then safety is going to be your restraints. Forensic nursing combines scientific knowledge and inquiry in an effort to serve A, victims of crime, B, perpetrators of crime, C, victims and perpetrators of crime, D, families of crime victims. All right, the answer to this one is C. Forensic nurses serve the perpetrators and victims of crime. For a competency hearing, the psychiatric forensic nurse has been asked to evaluate an incarcerated patient who has mental health problems. As the patient is being considered for sentencing, what is the psychiatric forensic nurse's role? Select all that apply. A, assessing the patient for level of competency. B, determining whether the patient is guilty or innocent. C, helping to determine the length of the sentence. D, completing a formal report to the court. E, becoming an advocate for the incarcerated patient. All right, the answer to this one is A and D. Forensic psychiatric nurses provide expert testimony and determine the mental competency of perpetrators, assess, treat, and evaluate victims and perpetrators. To determine a patient's legal sanity or competency, the psychiatric forensic nurse must assess all of the following except A, the patient's ability to distinguish right from wrong regarding the act committed, B, the patient's capacity to understand the nature of the act committed, C, the evidence with respect to the defendant's mental state at the time the act was committed, D, the patient's social network. All right, the answer to this one is D, the social network of the perpetrator is irrelevant in this circumstance. What is the purpose of HIPAA? Select all that apply. A, ensuring that an individual's health information is protected. B, providing third-party players with access to patients' medical records. C, facilitating the movement of patients' medical information to the interested parties. D, guaranteeing that all those in need of healthcare coverage have the option to obtain it. E, allowing healthcare providers to obtain health information to provide high-quality healthcare. All right. The answers to this one are A and E. HIPAA ensures that patients' medical information is protected while also allowing medical professionals to provide quality care. A 13-year-old boy is undergoing a mental health assessment. The nurse practitioner assures him that his medical records are protected and private. The nurse recognizes that this promise cannot be kept when the youth divulges. A, I lost my virginity last year. B, I am angry with my parents most of the time. C, I have thoughts of being in love with boys. D, my parents do not know that I hit my grandpa. All right. The answer to this one is D. So we are mandatory reporters of elder abuse, and the statement also shows that he is a danger to others. A nurse identified a nursing diagnosis of self-mutilation with borderline personality disorder. The patient has multiple self-inflicted cuts on her forearms and inner thighs. What is the most important patient outcome for this nursing diagnosis? Patient will A, identify triggers to self-mutilation, B, refrain from self-harm, C, describe strategies to increase socialization on the unit, D, describe 2 strategies to increase self-care. All right, the answer to this one is A. Identifying triggers will allow the patient to better control their thoughts and impulses when those triggers occur. It also helps them better avoid situations which may act as triggers. Medical records are considered legal documents. Proper documentation needs to reflect the patient condition along with changes. It should be based on professional standards designated by the State Board of Nursing, regulatory agencies, and reimbursement requirements. Proper documentation can be enhanced by A, only using objective data, B, using the nursing process as a guide, C, using language the specific patient can understand, D, avoiding legal jargon. All right, the answer to this one is B. Documentation should include your assessments, diagnoses, goals for the patient, plan of care, interventions, and evaluation of those interventions. Therefore, rely on the nursing process to guide your documentation. What assessment question is focused on identifying a long-term consequence of chronic stress on physical health? A, do you have any problems with sleeping well? B, how many infections have you experienced in the past 6 months? C, how much moderate exercise do you engage in on a regular basis? D, what management techniques do you regularly use to manage your stress? All right, the answer to this one is B. Stress can cause decreased immunity in long term. Which nursing assessments are directed at monitoring a patient's fight or flight response? Select all that apply. A, blood pressure, B, heart rate, C, respiratory rate, D, abdominal pain, E, dilated pupils. All right, the answer to this one is A, B, C, and E. So with the fight or flight response, you're going to have increased heart rate, increased blood pressure, increased respiratory rate, increased cardiac output, and dilated pupils. Which question is focused on the assessment of an individual's personal ability to manage stress? Select all that apply. A, have you ever been diagnosed with cancer? B, do you engage in any hobbies now that you're retired? C, have you been taking your antihypertensive medication that is prescribed? D, who can you rely on if you need help after you're discharged from the hospital? E, what do you do to help manage the demands of parenting a 4-year-old and a newborn? Okay, the answer to this one is B, D, and E. These questions assess the patient's ability to adapt, cope, and their support system. Hugo is 21 and diagnosed with schizophrenia. His history includes significant turmoil as a child and adolescent. Hugo reports his father was abusive and routinely beat him, all his siblings, and his mother. Hugo's early exposure to stress most likely made him resilient to stressful situations, increased his future vulnerability to psychiatric disorders, developed strong survival skills, or D, shaped his nurturing nature. All right. The answer to this one is B. ACEs put patients at higher risk of developing mental health disorders. ACEs are adverse childhood events. Your 39-year-old patient Samantha, who was admitted with anxiety, asks you what the stress relieving technique of mindfulness is. The best response is A. Mindfulness is focusing on an object and repeating a word or phrase while deep breathing. B. Mindfulness is progressively tensing, then relaxing body muscles. C. Mindfulness is focusing on the here and now, not the past or future, and paying attention to what is going on around you. D. Mindfulness is a memory system to assist you in short-term memory recall. All right. The answer to this one is C. Focusing on the here and now often relieves stress that comes from overthinking the past or future. Which statement made by either the nurse or patient demonstrates an ineffective patient-nurse relationship? A. I've given a lot of thought to what triggers me to get so angry. B. Why do you think it's acceptable for you to be so disrespectful to the staff? C. Will your spouse be available to attend tomorrow's family group session? D. I wanted to let you know that the medication is helping me feel less anxious. All right. The answer to this one is B. So you do not want to ask why questions, as it minimizes the patient's feelings. And the question that is asked is abrupt and places blame on the patient. It's not the best way to word it. The patient expresses sadness at being all alone with no one to share my life with, which response by the nurse demonstrates the existence of a therapeutic relationship. A, loneliness can be a very painful and difficult emotion. B, let's talk and see if you and I have any interests in common. C, I use Facebook to find people who share my love of cooking. D, loneliness is managed by getting involved with people. All right. The answer for this one is A. You want to validate the patient's feelings. However, you do not want to offer advice, approval, or disapproval. Option B, which was let's talk and see if you and I have any interests in common, is not appropriate as it can lead to boundary crossing. Mary is a 39-year-old attending a psychiatric outpatient clinic. Mary believes that her husband's sister and son cause all her problems. Listening to Mary describe the problems, the nurse displays therapeutic communication in which response? A, I understand you are in a difficult situation. B, thinking about being wronged repeatedly does more harm than good. C, I feel bad about your situation and I am so sorry this is happening to you and your family. D, it must be so difficult to live with uncaring people. All right, the answer to this one is A. So you want to empathize with the patient but not offer advice. Show that you are listening and validate the patient's feelings. A male patient frequently inquires about the female student nurse's boyfriend, social activities, and school experiences. Which is the best initial response by the student? A, the student requests assignment to a patient of the same gender. B, she limits sharing personal information and stresses the patient-centered portion of the conversation. C, the student shares information to make the therapeutic relationship more equal. D, she explains that if he persists on focusing on her, she cannot work with him. All right. The answer to this one is B. So you want to focus on the client and do not offer any personal information about yourself. Morgan is a third-year nursing student in her psychiatric clinical rotation. She is assigned to an 80-year-old widow admitted for major depressive disorder. The patient describes many losses and sadness. Morgan becomes teary and says meaningfully, "I am so sorry for you." Morgan's instructor overhears the conversation and says, "I understand that getting tearful is a human response, yet sympathy isn't helpful in this field." The instructor urges Morgan to focus on A. Adopting the patient's sorrow as your own, B. Maintaining pure objectivity, C. Using empathy to demonstrate respect and validation of the patient's feelings, D. Using touch to let her know that everything is going to be all right. All right. The answer here is going to be C. So sympathy involves more feeling sorry for a person and their misfortunes and less understanding of their feelings, whereas empathy shows respect and understanding for their feelings. Emily is a 28-year-old nurse who works on a psychiatric unit. She is assigned to work with Jenna, a 27-year-old who is admitted with major depressive disorder. Emily and Jenna realize that they graduated from the same high school and each have a 2-year-old daughter. Emily and Jenna discuss getting together for a play date with their daughters after Jenna is discharged. This situation reflects A. Successful termination, B. Promoting independence, C. Boundary blurring, D. A strong therapeutic relationship. All right, the answer to this one is C. A nurse-patient relationship should remain professional at all times. Drawing parallels between yourself and a patient causes boundaries to blur and can eventually lead to boundary crossing. Which statement made by the nurse demonstrates the best understanding of nonverbal communication? The patient's verbal and nonverbal communication is often different. B, when the patient responds to my question, I check for congruence between verbal and nonverbal communication to help validate the response. C, if a patient is slumped in a chair, I can be sure he's angry or depressed. D, it's easier to interpret verbal communication than it is to interpret nonverbal communication. All right. The answer to this one is B. Nonverbal communication is just as important as verbal communication. It can tell you a lot about how someone is feeling. If their nonverbal communication contradicts their verbal communication, there's more to know, and you should ask questions. Which nursing statement is an example of reflection? A, I think this feeling will pass. B, so you're saying that life has no meaning. C, I'm not sure I understand what you mean. D, you look sad. All right, the answer to this one is D. Reflection is a question or simple statement that conveys the nurse's observations back to the patient. You have been working closely with a patient for the past month. Today he tells you he is looking forward to meeting with his new psychiatrist, but frowns and avoids eye contact while reporting this to you. Which of the following responses would most likely be therapeutic? A new psychiatrist is a chance to start fresh. I'm sure it'll go well for you. B, you say you look forward to the meeting, but appear anxious or unhappy. C, I noticed that you frowned and avoided eye contact just now. Don't you feel well? D, I get the impression that you don't really want to see your psychiatrist. Can you tell me why? All right, the answer to this one is B. You are reflecting to the client your observations about their verbal message, about how their verbal message contradicts their nonverbal message. This allows them to reflect and organize their thoughts. Which student behavior is consistent with therapeutic communication? A, offering your opinion when asked to convey support. B, summarizing the essence of the patient's comments in your own words. C, interrupting periods of silence before they become awkward for the patient. D, telling the patient he did well when you approve of his statements or actions. All right, the answer to this one is B. Never offer your opinion, advice, or approval. Using silence and rephrasing the patient's words to convey their message back to them are examples of therapeutic communication. James is a 42-year-old patient with schizophrenia. He approaches you as you arrive for your day shift and anxiously reports, "Last night demons came to my room and tried to rape me." Which response would be most therapeutic? A, there is no such thing as demons. What you saw were hallucinations. B, it is not possible for anyone to enter your room at night. You are safe here. C, you seem upset. Please tell me more about what you experienced last night. D, that must have been frightening, but we'll check on you at night and you'll be safe. All right, the answer is C. The use of exploring allows the patient to elaborate more on their thoughts and feelings. What question by the nurse leader is helpful in managing a monopolizing member of a group? A, you seem angry. Is there something you want to discuss with the group? B, would it be helpful if you had time to think about the question? C, would you tell us about experiences that have frightened you? D, who else would like to share their thoughts about the issue? All right, the answer to this one is D. Monopolizing members take over the group and do not allow anyone else to participate. So you want to prompt other people to participate, so remind the group that everyone deserves a chance to speak. If the behavior persists, talk with that member in private. What advantages does group therapy have over individual therapy? Select all that apply. A, groups are less expensive than one-on-one therapy. B, groups apply an opportunity to learn from others. C, groups are homogeneous in composition. D, feedback is available from the group leader and group members. E, interpersonal skills can be practiced in a safe environment. All right, the answers are A, B, D, and E. Group therapy is a safe environment that allows patients to see other viewpoints and receive support from others around them. What group would benefit most from laissez-faire leader? A, art group, B, grief group, C, social skills group, D, anger management group. The answer is A. Laissez-faire leaders are passive and allow members to act in any way they want. This is beneficial in art because it allows them to express themselves in any manner. The nurse describes the purpose of psychoeducational groups as providing group members with knowledge and skills necessary to manage psychiatric symptoms. Which phase of group development is represented? A, planning phase, B, orientation phase, C, working phase, D, termination phase. All right, the answer to this one is B. The orientation phase introduces the group members to the purpose of the group and the needed skills to get what is desired from the therapy. The advanced practice nurse is assigned to a group of patients. Which patient would not be appropriate to consider for inpatient group therapy? The patient who A, has limited financial and social resources, B, is experiencing acute mania, C, has few friends on the unit, D, is preparing to discharge tomorrow, E, does not speak up often yet listens to others. Okay, the answer to this one is B. A patient experiencing acute mania is in need of more intense treatment, whereas the other options are more suited for outpatient treatment. Group members are having difficulty deciding what topic to cover in today's session. Which nurse leader response reflects autocratic leadership? A, we are talking about the fear of rejection today. B, let's go around the room and make suggestions about today's topic. C, I will let you come to a conclusion together about what to talk about. D, I will work with you to find a suitable topic for today. All right, the answer to this one is A. Autocratic leaders are controlling and do not encourage much group interaction. A patient continues to dominate the group conversation despite having been asked to allow others to speak. What is the group leader's most appropriate response? A, you're monopolizing the conversation. B, when you talk constantly, it makes everyone feel angry. C, you are supposed to allow others to speak also. D, when you speak out of turn, I am concerned that others will not be able to participate equally. All right, the answer to this one is D. Monopolizing members take over the group and do not allow anyone else to participate. So you just want to remind the group that everyone deserves the chance to participate if the behavior persists after you've talked to them a few times. Just talk to them in private. Now on to some dosage calc practice questions. A dose of 3,500 milligrams of medication has been ordered for a patient. The medication comes in 5 grams per 2 milliliters. What volume will you give the patient? Rounds to the nearest tenth. All right, so the answer to this one is 1.4 milliliters, and here's the work if you need to look at it. Okay. The next question is, a child weighs 13.5 kilograms and is prescribed a medication for 0.8 milligrams per kilogram per dose. The stock strength is 10 milligrams per 2 milliliters. What volume will you give the patient? Round to the nearest tenth. All right, so the answer to this one is 2.2 milliliters. And then here's the work if you need to look at it. All right.